wellness revolution starts now.
Welcome to the program. My name is Bryana Burken, Pharmacist and Physician Liaison with Physicians Preference Pharmacy. And today I am joined by Elaina Mango, Vice President of the Hotze Health Wellness Center. And we are going to talk about a very important topic today because it spills right into what we do at the pharmacy and the Wellness Center. We're going to unpack some questions about estrogen, but particularly how it plays into longevity, wellness, and overall health. And we haven't done this for a while.
No.
So I'm excited to be back with you, Elaina. And I'm glad that you have some questions for us today that we can open up the conversation about estrogen, its purposes, but hopefully expand it beyond the topics that we usually discuss so people have a broader understanding.
Great. Okay, so we're going to jump right in. So let's talk about estrogen. And most people think of estrogen primarily as a reproductive hormone. So can you explain why it's so much more essential to women's overall vitality across their lifespan?
Yes. So if you are listening and you're a female, it goes without the need to explain that our hormones fluctuate. Mm-hmm. And that is so much fun, right? It seems like it can be a moving target a lot of the time. So we seem like we can be going along and everything is good and we are balanced. And then we hit some stage of life that represents a change, whether that is as early as puberty, which actually causes a lot of issues for some folks. So when they're starting their menstrual cycle, if they go through pregnancy, when they become perimenopause as they approach menopause, and then menopause when they stop having their menstrual cycle. And so those all represent a lot of really important times where we need to balance those hormones, but it also shows us about how important estrogen is in each of those times. Like you mentioned, reproductive, right? We have to have a good balance of progesterone and estrogen to bring a healthy baby to term. So that's definitely important, but also understanding how estrogen plays into the importance of the immune system. If estrogen is not balanced, the immune system kind of starts freaking out and will come back around and attack the body. So we need to be sure that that is in balance. And then also, this goes for men and women, we're vain. It's important to us the way that we look, right? We want to take care of our skin. It might be more top of mind for women because we're wearing those topical products, the makeup that we choose. A lot goes into our getting ready routine each morning. But I oftentimes think about the impact of estrogen on the skin. So when we see that premature wrinkliness or it's losing some of its resilience or we're getting that crepiness, the elasticity, exactly. A lot of our compounded skincare products actually will support that crepiness and address it with estrogen replacement. So we don't even just use it internally, we can actually use it topically as well. But it literally is important from the surface of the skin down to a cellular level and important in the reproductive organs, as you initially said.
And you talked about all of these different shifts, right? Puberty, perimenopause, menopause. Talk about some of the symptoms that someone might experience as they're going through those different shifts and why they shouldn't ignore them.
So if you're a guest here with us, we talk a lot about estrogen dominance. And so that certainly is representative of something that is very real. But are we really talking about someone that has too much estrogen in their body, or are we talking about a progesterone deficiency? So we can't really talk about estrogen without talking about progesterone, even though all the other hormones and all the other sex hormones are all interrelated. It's that special balance between those two that is so exceptional. So when estrogen is out of balance, which in many cases in today's modern world, it's estrogen dominant because we are exposed to so many toxins that elevate or inappropriately or mimic elevation of estrogen, we start to show up with symptoms like weight gain, poor bone density, brain fogginess, and also, unfortunately, for those that are trying to bring a baby to term, if they don't have a good estrogen to progesterone ratio, they may not bring that baby fully to term, or it's not a healthy baby, which is really scary. So it can go beyond just what we experience as symptoms. And then I always come back to the skin as well, is how do we protect the integrity of that barrier that literally separates the outside world from the inside world. But usually when people come to us initially for treatment and they're symptomatic, it's the brain fog and it's the weight gain, I think are probably the two primary symptoms that we see.
And that weight gain could also be things like feeling bloated or even almost like digestive issues, but that's really not what it is.
Right.
It's their hormones are not balanced, primarily estrogen.
Right. And also a lot, it's not 100% tried and true, but a lot of times when we look and we see that tire, that midsection weight gain, estrogen loves the fat tissue because that's where it gets stored in the body. That's where it's supposed to get stored. So when we see that excess weight here, a lot of times that can be an excess of estrogen that the body is holding on to as well. And so that can be indicative of hormonal imbalance too.
So you're talking about estrogen dominance, but there's also estrogen deficiency, right?
Right.
So really, it's that balance that you're talking about between your estrogen and your progesterone. That's one or the other. Right?
That's right. And as we, of course, from birth through puberty, and as we go through, and I'm speaking about women in particular right now, birth through puberty, as we go into our childbearing years and then menopause, estrogen has a function at each of those times and then eventually starts to drop off. So much of the demographic that we see here in our wellness center are postmenopausal females that require estrogen replacement because they are on the downhill side of where their estrogen is falling in relationship to normal. So we have to come in with some estrogen support. So we're bringing them back up to mitigate those symptoms that they're experiencing due to estrogen deficiency or decline.
Okay, I want to go back to something that you had mentioned. And there are so many younger women that are having fertility issues. And so there are times when there is something that is wrong, that they may need to see a conventional doctor, maybe there's surgery involved, or there's an issue with, the plumbing, so to say, right? But then there are other times where infertility could be as simple as adjusting their hormones. Can you talk a little bit about that?
Yes. So we are not talking about the structural issues, which is what you alluded to, right? With the plumbing, it's really what it is. It's where the hormones flow through and to create a baby or not, depending on the health of how we are structured. Aside from that, I just constantly think about how conventional medicine is overcomplicating what we're doing. Yeah. And in pharmacy school, and I think in medical school too, we are taught when you hear hoofbeats, think horses, not zebras, which just means you do not have to overcomplicate what is happening here. If you are showing symptoms of estrogen deficiency, do you think it might be because you don't have enough estrogen? You know, when your gas tank is on low in your car, you give it gasoline. Right. It does not have to be overcomplicated. Not to downplay the complexity of hormones, but certainly when we look at some of these changes and these times in our life, even as young as perimenopause and childbearing years where women's estrogen and progesterone may not be balanced, we should be thinking about what are those hoofbeats that are around us? What is happening in the environment? One of the biggest threats, I personally think there's two primary threats that I have seen post-COVID and in the modern world. Most of my friends at this age are mostly past having children, but some are still having children. Sure. And so I'm kind of walking that with some of them.
People are getting older anymore, right?
Yes. And of course, we have guests that come to us that are in childbearing years and want nothing more than to be pregnant. One would be the lingering effects of COVID. And it's the spike protein. Yeah. The spike protein that is released or ejected, so to speak, by the SARS-CoV-2 virus embeds itself like nobody's business in the fat tissue. What else is in the fat tissue? Estrogen. Now, we have a lot more women who are not bringing healthy babies to term or they're miscarrying, and it is likely more correlative than causative, but those that have a high spike protein level are not having good fertility rates because the spike protein, when it lingers, causes excess inflammation, which is really no different than having excess exposure to environmental toxins or something that is foreign to the body. That SARS-CoV-2 virus is not supposed to be in the body. Now, living in a post-COVID world, we are all exposed to it. So now the question is different. What do we do about it? How do we get the spike protein down? Because the spike protein loves the reproductive organs. So there are competing mechanisms there, the hormones for the spike protein. And so how do we decrease that overall inflammation so that the body and the immune system can protect and can support a healthy pregnancy? The other would be the environment. So toxins, microplastics, which really boils down to a bigger category of xenoestrogens, which we use that word in pharmacology, xenobiotics, xenoestrogens. Xeno means that it's mimicking. So you might ingest microplastics through the water that look like or look something like estrogen to the body. So the body hangs on to it and it starts acting a bit like it would if it had estrogen, but with all these other side effects. So rather than giving something like estrogen and it can bind where it belongs and does its work, you're having kind of this mimicry going on, which causes a lot of problems.
Okay. And so that is a matter of detoxification and treating that, having too much spike proteins or being exposed to spike proteins. That's detoxifying.
Correct. And the detoxification of spike protein, it can be complex because there's different ways that you can get it out. You could get it out by physically filtering the blood. There are different ways that that can be done. You can do something as simple as vitamin and mineral supplementation that specifically latch onto the spike protein and denature it or break it down so that you can urinate it out, which is mostly how it comes out. Or you can also use prescription medications that help with this too and help with the symptoms of long COVID and spikeopathy. But much of it is hanging on to those toxins. Initially, we're also talking about prevention. So when you take an internal inventory of your home, which is way harder said than done, but when you take an inventory, start small, by the way, look at where you're having those microplastic exposures or ingredients that are causing even low-level inflammation in the body and in the blood that function as hormone disruptors. And another one I think about is topical skincare and also really anything that is going on the body. So that could be, it could be just confined to the face, but it might be shampoos, it might be conditioners, it might be lotions or whatever else you might put on your body, right? Okay. If it's got parabens in it, which disrupt hormones, then there you go. Yeah. Because it's such an absorptive and large surface area and gateway to the body.
And again, that we were talking about infertility, but that conversation is much broader, right, in terms of our environment and all of the microplastics and the toxins that we're all exposed to, and we get these symptoms that we don't know why we have them.
Right. It's frustrating, and I just want to say one more thing on that because people say, oh, yeah, that really sounds all, great and everything. Where do I start? Yeah. How do I go through my home? Don't do everything at once. Find the one thing that you do every day. So, for example, this is a recent swap that I made in my home. I love coffee. And every time you see me, I'm probably going to have a cup in my hands. That's how I start my day as well. So that's something that I'm exposed to a lot of, is a lot of coffee. And so my coffee machine is really important. What's going on in the coffee machine? They're usually made out of what? Plastic. So I looked long and hard to find a plastic-free brewer so that no hot water or any brewing components for the coffee is coming in contact with plastic. It's stainless steel or glass. And so for me, it's not a huge swap. It's one swap, but it's likely to move the needle. So just start there. No need to overcomplicate.
Even drinking out of plastic bottles, we're hydrating all day long, right? So it's drinking out of those plastic bottles or even plastic cups, right? Use glass or stainless steel, right? Glass, there you go, glass. You're a good role model. All right, so now let's go to the other end of this, and that's aging. Many conventional providers will say to women, we've all heard it, that this is just, all of your symptoms are because you're getting older. Why should we be pushing back? What do we want to encourage women to do when they're feeling these symptoms? Because it could be that simple matter of estrogen dominance or deficiency.
I think, first of all, talking about it. We all know someone who's been to one physician or multiple who have been told it's either in your head or there's nothing I can do for you or here's an antidepressant. I just spoke with a woman on the phone last week that told me that story that we hear a lot. And then they get decades down the road and they're still on that antidepressant. And guess what? Their symptoms aren't fixed, but now they're having side effects from the antidepressant. So
we see it
every day. Listen, talk to your friends, talk to your family, because you're going to have a conversation probably this week or this month about someone who is suffering from some sort of hormone dysregulation. So don't be afraid to say to them, ask the question why, go get a second opinion, because unfortunately, if you're one of those people who has been on those medications for several years without symptom resolution, has it worked? And if it hasn't worked, then we need to go a different direction. Like when we were talking about the initial symptoms of estrogen imbalance or deficiency, one of those can be depression.
Yes.
And so sometimes they will give antidepressants for it. But when you could give something that addresses the root cause, why would you give a drug with so many side effects?
You want something more natural, something that mimics your body. And then that brings me to, there's so much conversation. And whenever women come to the Hotze Health and Wellness Center, they're worried about going on estrogen because they don't know if it's safe, and they hear, all these stories, and with the internet, it's really prevalent, and they're afraid to go on estrogen. Let's talk about bioidentical hormones. Let's talk about why estrogen can be a very safe option.
Yeah, so much of that misconception came from the Women's Health Initiative study, which we reference a lot. In the early 2000s is when they concluded their study. But one of the differences between what we're doing, which is bioidentical hormone replacement therapy, we'll call it BHRT, which is what you're asking about, is different than what they used in that study. Much of the misconceptions and myths around hormone therapy as a whole has stemmed from that study, causing misconceptions in the safety of hormone replacement therapy. So when you're looking at what they used, which is a combination of natural estrogen derived from a horse's urine, a pregnant horse's urine, mixed with synthetic progesterone, so synthetic, we had a lot of problems with those study outcomes. Again, different conversation. We understand we're getting lumped into the whole HRT conversation. Bioidentical is different because it means that our hormones are mimicking, to use your word, what the body is naturally making. So when you have something that looks identical to the body as what your body already naturally makes, we would expect to have the same reaction or same response. Therefore, that's how it helps to alleviate the symptoms.
Good. All right, let's talk about getting to root causes. We talked about diet, stress, and environmental factors. What are some other very simple lifestyle practices that people could make those small changes to in terms of their overall health and vitality?
Actually, I think diet is a place where we should kind of talk about that because it seems foundational, but it oftentimes gets skipped over. And it wouldn't be fair to paint a one-sided picture here. Even your own hormones that you make aren't all good guys, right? They have to be in balance, right? So we actually make primarily 3 types of estrogens, E1, E2, and E3, which is estrone, estradiol, and estriol. You don't hear about generally putting estrone in compounded products. You want either of the other two, okay, the estradiol or the estriol. And certain estrogens have various benefits for certain actions in the body. Some of them, if they build up, can cause toxicity. Like to talk about what the body's naturally doing on its own, even in the absence of hormone therapy, you can develop breast cancer, right? Because it's so sensitive to the estrogen in your body. So one of the options that I absolutely love, and it's something I take every day, although you can achieve it dietarily, is the detoxification of estrogen with a compound called DIM. And this is not a compound that comes from the pharmacy. You can buy it in capsule form from Physician's Preference Vitamins. Also, though, what that is encapsulated is the benefits of eating whole cruciferous vegetables. So when you eat your green leafies, you eat your broccoli, your cauliflower, things like that, when you consume them in their most whole form, meaning not blended, not boiled down to a soup and such, as they travel down through the gastrointestinal tract, it creates that compound called DIM. DIM is required to detoxify your body from the less helpful estrogens. So it's not all about hormone replacement therapy either. It's about the dietary choices. It's about decreasing stress because that tears up the gut, whether that's prayer or meditation practices, and decreasing the overall inflammatory burden on your body. Also, as we increase activity in our lifestyle, we can help to build muscle, we can help to shed fat, which helps to counteract some of that extra storage, because remember we talked about how estrogen loves the fat.
Right.
So the more fat you have, the more estrogen, the more opportunity for storage of excess estrogen you are promoting.
So it's all of the things that we constantly talk about. It's not just balancing the hormones, right? Because your body makes the hormones and they have to be balanced when we're degrading. But it's good sleep, it's strength training, it's movement. And that you don't have to walk 10 miles or, lift 300 pounds. It's doing those baby steps. Okay, this is always so interesting when we talk to you about these topics. Estrogen comes in different dosage forms, right? So it doesn't just have to be a capsule. So can you talk to us about the different dosage forms that estrogen?
Yes, I can. So at Physician's Preference, we offer several different dosage forms for estrogen specifically, since that's what we're talking about. Topical cream, vaginal cream, oral capsules, and sublingual tablets. So we'll link to another episode where we talked about the different types of dosage forms, because I cover some of the common questions that we get is, oh yeah, I used to be on the estrogen cream. Now I'm on the sublingual tablet. Which one is better? Well, you had this prescription written by your physician, so they deemed it was better for you. One dosage form is not superior to the other. It is pivoting to what is currently going on in your body. So depending on the hormone that we're talking about, if I give you an oral capsule, it's traveling through your gut and it's supposed to get broken down there and converted to its active form, but your gut's not healthy, you're wasting your money and you're not going to have a good therapeutic outcome. So one is not superior to the other. It also has to do a lot with lifestyle and preference. So when we talk about the topical application of hormones in particular, my questions are, what is your occupation? Are you outside? Are you sweating a lot? I mean, I do ask these questions, but it's the physician's choice for what to describe, for what to prescribe, right? But I'm confirming is what I should say at counsel. What is your occupation? Are you sweating a lot? Are you showering? Or are you in the pool a lot? Do you have grandkids? Do you have pets? Because if you're going to have more opportunities to come in contact with someone else and transfer that hormone, not a good option. We should be putting it in the mouth, right? So a lot of it boils down to lifestyle too.
Yeah. And I think it's a good point that you really do need to not self-diagnose, right? So one of the things that you talked about was working with a qualified provider, right? Mostly alternative and integrative providers are going to know more about hormone balancing or care more about hormone balancing and discuss it. And a lot of times in conventional medicine, what we hear when guests come to the Hotze Health and Wellness Center is, my blood work looks terrific. And at the Hotze Health and Wellness Center, we don't just diagnose off of blood work. We also use clinical symptoms. Can you talk about why that's so important?
Yes. Yeah, I think we should start about why lab ranges are defined as they are. So I think when we understand that, it actually becomes pretty clear, as we know. Those lab ranges of what's considered to be normal is actually just an average of any particular group of people at any time when that lab range is actually created. So if we took an average of, you and I right now, it's going to give a number, but what about when we go down and we talk to the person down the street? Do we expect them to be the same? No.
Right.
And what if they're a male? Do we expect them to be the same too? It's all going to be very different. So it gives us guidance when we fall within the normal range, but also at the same time, someone might be on the low or high end and feel fine. So we also don't want to overprescribe or complicate the regimen too much. So even if your lab results are normal, but you go to your doctor and you say, I don't feel well, they should be listening to that. If they do not listen, run for the hills or just call us and we'll help you, find someone that will understand. But that's super important. I wish we did not hear that as often as we do, but unfortunately it's the truth.
Yeah. And I will say that we are finding that more and more individuals are becoming so much more educated and they are becoming self-advocates for their health. And we love that because at the Hotze Health and Wellness Center, we want to partner with you on your health. And we want to make sure that we're listening to those clinical symptoms and making sure that we can get to the root causes rather than treating individual symptoms.
Right.
All All right. Well, this has, as always, been so beneficial, and I hope that our viewers feel that way as well.
Yes.
And do you want to talk to them about how they can contact us?
Yes, absolutely. So, of course, if you're looking for information about our estrogen compounds, you're already working with someone who is prescribing this, or you're looking for a shift, and you've got questions, please call us directly. You can reach us at Physicians Preference Pharmacy at 281-828-9088, and we can connect you with the Wellness Center. We all work together here, and certainly it would be our privilege to serve you.
That's right. And at the Hotze Health Wellness Center, we should mention that our wellness consultations are always complimentary, and you can reach us on 281-698-8698.
Thank you. We'll see you next time.
Thank you.
At Physicians Preference Pharmacy, we understand that the quality of your compounded medications directly affects the way you feel, which is why we believe that your pharmacy should specialize in compounding medications while also delivering extraordinary hospitality and guest service. We believe that both patients and prescribers should accept nothing less than consistency and quality from their compounding pharmacy. This is why we've implemented some of the strictest quality standards in compounding, exceeding standard requirements, achieving PCAB accreditation, which is the Pharmacy Compounding Accreditation Board, an organization that sets the highest standards in compounding pharmacy regarding the safety, cleanliness, and quality of your compounded prescriptions. Because of our commitment to complete health and wellness, we are dedicated to making your medications free of lactose, parabens, artificial sweeteners, and any unnecessary dyes, binders, or fillers present in many other medications, offering you the cleanest products possible.
Information provided on this program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this program is at the listener's discretion.